This is Mon Health Live, your source for the latest news, numbers, and vaccine information related to COVID-19. It's what you need to know now to make informed decisions for you and your family. Here are your hosts, Mon Health System CEO David Goldberg, Mon Health Chief Nurse Executive Dr. Crystal Atkinson, and WAJR's Kyle Wiggs.
And good Saturday morning. Welcome to the latest edition of Mon Health Live. We started the show a few months back to get you the information you need about COVID-19, the protocols, the vaccines, which that vaccine drive is going very, very well. A lot of people in the city of Morgantown, a lot of people in the county, a lot of people in the state taking advantage of the vaccine. So we'll talk about all of that over the course of this program. Dr. Crystal Atkinson is with us, Chief Nursing Executive of Mon Health Systems. Dr. Atkinson, thanks for coming on.
Good morning, Kyle. Thank you.
Thanks for coming on. And Dr. Suzanne Gharib is with us as well, rheumatologist with Mon Health. And Dr. Gharib, thanks for your time this morning.
Thank you, Kyle. Thanks for having me.
First of all, Crystal, where's David? Where's he been lately? We haven't heard from him in the last few weeks.
Unfortunately, David's had a couple of conflicts, so he's turned it over to me. So we'll continue to get through this Saturday without him.
Well, you do a great job. We appreciate that. Let's start with the updates. We're up to, about 40,000 doses of the vaccine being administered?
We have from our community drive. We're really excited about that, and just seeing the level of engagement with our community and just the excitement about that. It's really good. Again, the process is just really easy. Vaccinate.wv.gov for people to go on the site, get registered, and it's extremely important to make sure that once you register, you're answering your phone, because then you'll have follow-up information from somebody calling to actually schedule that appointment with you. All
right. Just anecdotally, I was near the hub. I didn't go in. I dropped my wife off. She got her second dose this week, and the place was buzzing. So, and it's a safe place. All the protocols are still in place, but there was a line. So there's a lot of people getting both their first and second doses. So thankfully she's fully dosed, and I'm getting my second dose this week. I went through the Walgreens system, which was very efficient, worked well. So again, it really doesn't matter which path you take, just as long as you get the vaccine.
Absolutely. That's good. And that's great to be able to hear from you, your experience, your wife's experience. Just as we've talked, we've all been fully vaccinated, have not had any horrible side effects, so it's definitely a safe way to be able to make sure that we can stay safe during this time. Dr.
Gharib, what was your experience like with the vaccine?
I had a surprisingly pleasant time with it, frankly. A little bit of a sore arm, and that's about it. It was relatively easy otherwise.
Okay, this is a question for both of you, and I'm sure, again, this is anecdotal, but I'm sure we've all encountered people that have had no problems at all, a slight sore arm or whatever, but we've also probably all encountered folks that have had a few side effects, maybe some chills or maybe flu-like symptoms. We'll start with you, Dr. Atkinson. What's your advice to the people that just, have to kind of battle through a few side effects here or there?
Yeah, and that's a great point, Kyle. We want to make sure that whatever those are, again, usually very mild, but just listen to your body, right? So if you're having, a slight fever or headache, take some Tylenol, ibuprofen, whichever you can tolerate. But most importantly, what I've heard most from people is that just feeling fatigue, just take the time and get the rest that you need.
Mm-hmm. Dr. Gharib, anything to add to that?
There's some unusual side effects to a lot of different things. I think it's just bearing with it, and this is going to be our best chance of getting rid of this pandemic. So it's doing our part, basically.
Mm-hmm. All right. Again, Dr. Atkinson, who's eligible at this point for the vaccine? And again, where do people need to go to get the process started if they haven't already?
So right now we're looking at anyone that is 16 and older to have the ability to be able to get the vaccine. As we've talked about early on when we had first responders, and then we looked at the different subsets of people that had comorbidities. They have maybe some diabetes, high blood pressure, etc., our older population. But now, again, 16 and older, everybody's welcome to come and get the vaccine. So we want to go to vaccinate.wv.gov. Right there on the website, you'll have the information and to get yourself registered.
Mm-hmm. Again, this is for either of you as well, but there seems to be a drive to get high school students vaccinated. We know that most of the staff, the teachers and the service personnel have been vaccinated, but getting the high school students themselves vaccinated, what can you tell us about that?
Yeah, I think it's a great opportunity. I mean, again, as we start to look at, not only just the COVID-19 virus that we've been dealing with, but also different variants and how we look at transmission, whether people are asymptomatic carriers, et cetera. The more that we have, the kids are in school, they're participating in, activities. Again, it's one more defense to be able to get everybody vaccinated and protected. We also want to think about that we could have, as we look at our younger people, we want to think about that they could be asymptomatic carriers that could bring those to, say, their grandparents. So we just, again, we're offering that just to be able to spread that amongst the community.
Okay. Dr. Gharib, anything to add?
Well, I mean, I think the data is looking good in younger people as well, and they've done this in clinical trials, and we're seeing good results. So eventually we're going to have to get our younger population vaccinated as well. Mm-hmm. This is the first step towards that.
All right, Dr. Gharib, as we mentioned, you're a rheumatologist with Mon Health. What is that? What is your practice?
So rheumatologist, most people don't want to know who we are until you have to meet us. So it is a subspecialty within the internal medicine realm that deals more with joints, soft tissues, autoimmune diseases. So fairly complicated stuff, and that's kind of what I do is deal with some of these more complex diseases like rheumatoid arthritis and lupus, et cetera.
Your patients have, I would imagine that especially the autoimmune patients that are compromised a little bit. This COVID thing had to be, I mean, it's been scary for everyone, but some of the patients you deal with, I'm sure, had to be extra careful through this process as we kind of work our way through it.
It's definitely a little more complicated. I mean, how our medications impact the immune system and then even how it interacts with the vaccines. It's been a challenge, but a learning experience all rolled into one.
Okay, well, before we move on away from the vaccine, every case is different, I would imagine, but with some of the patients you dealt with, what was your advice to them about this vaccine?
So, I mean, the American College of Rheumatology is highly encouraging people with autoimmune diseases to get vaccinated, especially within the rheumatology realm. There are instances where we have to hold medications or adjust how we're taking medications to improve the efficacy of the vaccine. So we're being very careful in advising individual patients in terms of how to best get the most effectiveness out of each vaccine.
Okay, efficacy, that's a doctor term. Define that one for us.
How effective it is,
okay.
how well it works.
All right, so there's a chance that in some cases with your patients, they take this vaccine and the medicine they're taking tries to fight it off. Is that a correct perception?
That is absolutely a correct perception, where the medicine you're taking keeps your immune system from getting the right amount of immunity. So sometimes you have to hold medications to get your best response.
Mm-hmm. Okay, a little bit more about you and your practice. What kind of patients do you treat, and who would come to see you? Who would have an appointment to see you?
So we treat a lot of very wide variety of autoimmune conditions, including rheumatoid arthritis, Sjogren's syndrome, a variety of diseases like ankylosing spondylitis, psoriatic arthritis, so all kinds of different people. And it depends on the symptoms. Usually it's your primary care physician or one of the other specialists you're seeing will detect an abnormality that says, oh, this looks like it's coming from your immune system. Rheumatology should probably have a look.
And how has this pandemic, how has COVID-19 impacted your practice and what you do?
It's been an interesting run. Initially, everybody was very frightened. Our established patients were very scared with the medications they're taking, that it put them in increased risk for COVID. So we had to do a lot of telemedicine. We had to do a lot of counseling in terms of how to manage medications with this pandemic.
Are things getting back to normal, I guess as normal as they can be at this point?
We're slowly clawing our way back to normal. So it is definitely getting there. We're doing much less telehealth and more live appointments with patients, but we're keeping all those options open. This is it's an evolving process.
Mm-hmm. All right, very good. We need to take a break here. This is Mod Health Live for the Saturday morning. Thanks for listening to WAJR. Our special guest, Dr. Suzanne Gharib, and also, of course, with us, Dr. Crystal Atkinson, Chief Nursing Executive, Mon Health System. We'll take a break. We're back with more after this on WAJR.
Tracking COVID-19 with the Mon Health experts. This is Mon Health Live. Here's Mon Health CEO David Goldberg and Chief Nurse Executive Dr. Crystal Atkinson.
Mon Health Live for Saturday morning. Thanks for joining us. 104.5 FM, 1440 AM WAJR as we track COVID-19 and try and get the information to you that you need to know about the pandemic. And we talked a lot about the vaccine in our first segment. We are with Dr. Suzanne Gharib, a rheumatologist with Mon Health, and also Dr. Crystal Atkinson, Chief Nursing Executive of Mon Health System. And Dr. Gharib, we talked to you in the first segment about the patients you see, and obviously people with autoimmune deficiencies are they're perilous under normal conditions, but with this pandemic, were some of the patients reluctant to see you in person, and you got around that with telehealth appointments, as you mentioned, but obviously a lot of patients that you see can't put health care off. So again, how did you work your way through this, and are things coming back around?
So it took a lot of counseling because, again, I think there's an innate fear to go out in public, and everybody was frightened to be seeing their doctors or to continue various medications. But I think it's incredibly important when you have a medical illness of any type, but particularly autoimmune diseases, you have to err on the side of controlling that disease because it has so many other implications if you don't.
Mm-hmm. This is a question for both of you, but we're learning about this as we go along, and certainly the vaccine has helped, and it's cut down cases, and it's allowed us to get back a little bit closer to normal. But we'll start with you, Dr. Gharib. Do you see this continuing? Is this something that people are going to have to continue to look out for, perhaps continue to get vaccinated for as we move forward?
I mean, there's a lot of suspicion that this is going to become what we call endemic, which is just kind of a bug in our world, so to speak. So there may be a need for yearly vaccine or twice every other year vaccine. That has yet to be kind of played out. But definitely there's going to be a transitional phase where we're going to have to take more care and see how this evolves, how this changes going forward.
Mm-hmm. Dr. Atkinson, anything to add there?
No, completely agree. I think we just have to continue just to look at the science and the data as this evolves.
Mm-hmm. Now, Dr. Gharib, you provide care at the Mon Health Medical Park. Is that correct?
That's correct.
All right. And there's a new location that's open or opening soon?
We are trying to start up a new location in Weston in August.
Okay.
To allow patients from the central part of the state to have someplace closer to home to go.
All right, so a lot of those patients are having to travel an hour and a half into Morgantown currently. Is that correct?
That's approximately correct. Elkins is very far away.
All right, so what goes into that? What goes into opening a new location to treat the specialized patients that you see?
Well, you have to make sure there's appropriate nursing staff. You have to make sure that there's appropriate labs and services offered. We do a lot of infusions, injections, a variety of different services that are provided. And to set that up a little more locally takes some work, but at the same time it offers a wonderful service for people who are already arthritic and don't want to drive an hour and a half each way to see their provider.
All right, so that would obviously help their quality of life when they didn't have to make the round trip into Morgantown. Dr. Gharib, we've talked through the weeks to Dr. Atkinson and to David Goldberg as well about the protocols that are in place at the hospital, at Mon General, and how clean it is. Can you kind of give us an idea at Mon Health Medical Park, the protocols that are in place?
The protocols really stress the social distancing, giving plenty of room in the waiting rooms so that people don't feel like it's crowded or they're having to get away from other people. They're scheduling things appropriately to allow for plenty of time so that even if you're a little delayed in your appointment, you're not running into a lot of people. And there's plentiful exam rooms, which, again, offers a lot of separation, and masks are required for all of the staff, any incoming patients, which it puts safety at a premium.
Yeah. How long's the medical park facility been open?
Been quite a while. It's before my time by several years, if I'm not mistaken.
All right, so it's been there, but it's a place that obviously it's perfect for what you do. It's the facility that is geared specifically to the type of care you offer.
Yeah, it's designed for outpatient medicine, and there's a need for that where people are not going into a hospital facility. It's completely unrelated to hospital-based services. Mm-hmm. And that's a good thing.
All right, again, a question for both of you. Why is it important for now to patients to not put off the routine care? Dr. Atkinson, we'll start with you. I know a lot of people have a lot of anxiety through this, and it's tough to get back out there, so to speak. What would you say to someone who needs to see their primary physician or a specialist?
Yeah, certainly. We certainly have been stressing that it is definitely not the case that we want to have anybody put off any medical care. So if there is something that has been bothering you for a while, or there's something that new issue that has developed, we have a whole array of opportunities from telehealth, where you can log in and you can see your physician, as well as clinic visits. If you do not have a primary care physician, we have on our website, monhealth.com/physicians, where you can just log right on and you can choose a primary care physician. We have wonderful primary care physicians that have availability to see you.
Dr. Gharib, anything to add to that, to people that may be reluctant to go see the doctor or go to the medical park?
I think you're trading the risk of something potential, which is COVID, for the risk of something certain, which is your health will deteriorate if you don't maintain good care. So I think it's incredibly important to maintain regular appointments with your doctor, and if there's something new that develops, to get it addressed promptly.
Okay, well, we're not through this completely, but there's, to use a cliche, there's light at the end of the tunnel. I think people are feeling better because it's spring and you can get outside more, and people probably took advantage of that during the Easter weekend to see their families get outside a little bit more. Dr. Gharib, what's your outlook here for the next few weeks or the next few months as we continue to make progress in putting this pandemic behind us?
I think we're going to get back to some semblance of normalcy. It probably will be a hybrid from the old normal and the new normal. But hopefully with more people getting vaccinated, we see the cases continue to decline nationwide. And we start getting back to more live visits, family gatherings, et cetera. I think it'll be wonderful.
Dr. Atkinson, anything to add?
Now, just completely agree with that, and then just making sure that we're just staying steadfast. I know it's been a long road, but we just need to continue to keep up those mitigation factors so we can all stay safe.
Do you see, Dr. Gharib, in the patients that you have seen, do you see their attitudes or their mental state changing? Is it more of an optimistic view now than it was perhaps 2 or 3 months ago when we were in the dead of winter?
I think there is some optimism. I do think people are by and large frustrated, particularly my more elderly patients who are kind of lonely and they can't see their families. But there seems to be light at the end of the tunnel. And the ones that are getting vaccinated that can see their vaccinated friends, there is a hint of hope there.
Mm-hmm. Well, that's the thing. And Dr. Atkinson, I know that the guidelines have been loosened a little bit for people that have been vaccinated. It's okay to get together now in these small groups as long as everyone's vaccinated, right?
Absolutely. And, certainly want to be able to encourage that. And maybe that is something that the folks that are vaccinated, they can certainly share that with people that maybe still have concerns about being vaccinated, that's something that once we are all in that state that we can enjoy that fellowship together. Mm-hmm.
All right, about a minute left in the program. Dr. Suzanne Gharib has been our guest, rheumatologist with Mon Health. Again, folks that may need your specialty, what would you say to them in terms of getting the process started?
Get all your information together, request a referral, and hopefully we can work you in as quickly as possible.
Mm-hmm. And Dr. Atkinson, anything to add about any of the topics we've discussed here?
No, just continue to be vigilant and go to the website, vaccinate.wv.gov if you have not been vaccinated yet, so you can get registered.
Okay, vaccinate.wv.gov. That is that's the website to register. And again, in Monongalia County, in the city of Morgantown, there's it's going very well at the vaccination hub, at the mall, Walgreens. Again, there's plenty of places to go to get vaccinated if you are so inclined. Well, ladies, thank you for the information today. We really appreciate it. Good information.
Thank you.
Thank you, Kyle.
All right, that is Mon Health Live for this Saturday. Thanks for listening on WAJR.